We have a graphic to show you that kind of like shows you different conditions sleep apnea is associated with. Doctor, walk me through these. Irregular heartbeat.
Yeah, so these are a few of the things. So sleep apnea, if you recall, with every apneic episode, which can be every 4 minutes or every 45 seconds, the body's oxygen levels drop, you have an increase in carbon dioxide, and the body's in stress. So you have cortisol, all these stress hormone releases, including adrenaline, which is a stress hormone stimulant. So when you have this barrage of adrenaline spikes in your body throughout the night, it can lead to arrhythmias and irregular heart rates and tachycardias. In fact, quite frequently when patients are referred to a sleep lab because of other symptoms, they're monitored on their electrocardiogram and we find they're having arrhythmias at night we didn't know, which gives an opportunity to treat those and prevent further problems.
How much is stress associated with this?
So,
if not,
interestingly, sleep apnea or even a disrupted sleep, because again, we're focusing on a specific kind of sleep disorder, but there are many sleep disorders, increases stress. It increases hormonal changes, it increases the way the mind thinks. We're tired more often, which makes you more likely to not function at work well. So I think it's more that sleep apnea can increase stress as opposed to stress increasing sleep apnea. Now, other disorders like insomnia and things like that, certainly stress can contribute to. So I would say they're related, but not necessarily one causing the other.
And we talked about the CPAP, which is obviously, it's positive and it works. Are there other medications that patients can use?
Medications are not really that effective in sleep apnea. Part of the reason is the deeper the sleep you're in, you could argue, the worse the sleep apnea is because the muscles are most relaxed. So if you're using sleeping pills, certainly if you drink before bed, it can actually make it worse because the muscles are more relaxed. There are certain medications for people with very advanced cases to kind of keep them awake during the day, but they have some consequences again because they kind of have stimulating effects. So sleep apnea is really a mechanical, it's a complex problem that's best treated mechanically. About 85% of people get the CPAP and can wear it. A few people just can't wear the mask, and there are other things, these dental appliances and other ways to help those people. But the masks are so easy to use and so easy to manage that they really become the first-line therapy.